Well, thank you everybody for being with us. Well, it's this evening my time, but I know it's this morning or other times of the day for everyone else. So welcome to our second of two planning meetings for World Radiotherapy Awareness Day initiative for regional champions. My name is Katie Wakeham. I'm a clinical oncologist based in London in the UK, and I'm here with the RAD team who will introduce themselves a little bit later. We're very delighted that you've taken the time out from your busy schedules to join this important meeting today. We will record the meeting and share it on our YouTube channel so that anyone who's missed it or wants to listen again. I know that many of you were involved in the first RAD campaign in 2025, but just to recap our three main objectives. So the first is to recognise the global value of radiotherapy and radiotherapy professionals who are committed to improving and saving the lives of people with cancer. The second is to highlight the current inequalities around access to care and the need to improve infrastructure and skill development. And third, to educate, inspire, and mobilise people from policymakers and clinicians to people with cancer and their families and carers, so that they can influence national and international policy and funding. We have two main goals in our 2026 strategy. The first is to work with regional champions, and the second with patient consumer groups. I'm just going to briefly mention the patient advocacy section before we get down to talking about regional champions. So in terms of this initiative, we're actively seeking patients, survivors, consumer advocacy groups and individuals from around the world to share their stories and join the RAD platform. And this would provide them with the opportunity to network with other groups, professionals, industry representatives and policymakers. More specifically, we would be looking for patient advocates to co-design educational resources about radiotherapy, treatment options, and the rights of people with cancer, to run campaigns to destigmatize cancer and promote early detection and treatment, to ensure the patient voice and experiences are considered in policy, and to engage in advocacy efforts aimed at influencing healthcare policy, funding, and access to care. Great, so moving on to why we're all here this morning, and this is the Regional Champion Initiative. So just to recap, I know you had this in some email correspondence. Regional champions are individuals who possess a deep understanding of their country or community's specific challenges and barriers to radiotherapy access. By leveraging this knowledge, regional champions can tailor RAD's messages to resonate with local values, address challenges, and prioritise community needs. We would like your role to include one or more of the following: to make the work of radiotherapy colleagues visible, to capture real-world stories and data to drive cultural and political change, to engage patient support groups and local consumer advocacy groups, and in the future, build credibility with policymakers and funders through collective action. Just one note about the Regional Champion Initiative is that RAD is not having any formal structure, nor positions, nor recruitment process for this. It's really a community that we value and that everybody can join. So I'm now going to hand over to RAD's co-chair and founder, Sandra Turner, to lead the introductions.
Hi, everybody. Thank you so much for turning up in what's for some of you is not a very nice time zone. So as Katie said, I'm Sandra Turner. I'm the co-chair of World Radiotherapy Awareness Day. I've met a lot of you, but hope to get to know other people over time. So I work in Sydney, Australia. I'm a radiation oncologist. And what I'm going to do is just get the other core committee and team members to introduce themselves to you quickly. We're also being split across the two meetings. So if you want to meet the other committee people, you'll have to watch the recording from the first presentation. But I'll kick off. Christian, I might get you to introduce yourself, please, first.
Sure. Thank you so much, Sandra. Hi, everyone. It's really lovely to see all of you here today. My name is Christian Luliak. I recently joined the team as a project manager, and I'm currently based in Manila, Philippines. Over to you, Sandra. Thank you.
Jeff.
Yes, hello everybody. My name is Jeff White, and I'm in Washington, D.C., the United States. And I work for ASTRO, the American Society for Radiation Oncology. So I work with our radiation oncologists across the country. I'm also a cancer survivor, so I kind of bring two different hats to this role here.
Thanks, Jeff. Lucinda.
Hello, I'm Lucinda Morris. I'm a radiation oncologist based in Sydney, Australia, and I joined the WRAD Global Committee last year under Katie and Sandra, and also very exciting to be here. This is wonderful.
Thanks, Lou. Now we'd like to hear from all of you. I can't see everybody on my screen. Thank you for people that have got their video on. For people that haven't, it's okay to do that. We love to see your faces and know who we're talking to. Thank you. And we'll just get people one by one, maybe very briefly, just a few seconds to say who you are, where you're from, and what your professional or non-professional connection to radiotherapy is. And I might start with Ben, who's actually at the top of my screen at the moment.
Thank you, Sandra and Katie, and all the RAD committee members. It's a pleasure to join in. My name is Benjamin Semata. I'm a radiation therapist from Uganda Cancer Institute, and I'm very passionate about radiotherapy advocacy, especially in low middle income countries where it's really having significant awareness barriers. So it's a pleasure to be a part of this initiative, and I look forward to contributing to this.
Thank you very much. Yolanda, would you like to introduce yourself, please?
I would. Good morning, everyone. I'm Yolanda Surgeon. I'm a radiation therapy academic at the University of Newcastle in Australia. We are the largest provider of radiation therapy graduates on this side of the world, and we have a small team, but very motivated team to support RAD. We did it last year, and we're really excited about doing that again this year.
Thanks, Yolanda. Tanya, sorry if I don't say your name wrong. Would you like to introduce
No,
yourself?
you pronounced it very
Oh,
you
good.
pronounced it very, very well. Thank you very much, Sandra. I am Tanyara Chifamba. I'm a radiotherapist from Zimbabwe, practicing in Namibia, and I'm pleased to be here. Thank you.
Thank you. We're pleased to have you. Harley.
Hi, I'm Harley Rutherford. I'm down in Melbourne, Victoria, in Australia, at the Peter MacCallum Cancer Centre, and I'm a medical physicist down here, just very newly qualified and looking for other ways I can help out in the radiotherapy community. So yeah, thanks, Sandra and Katie.
Fantastic. We're looking for lots more physicists, so that's wonderful. Courtney.
What do you know? You found another physicist. Hi, Harley. My name is Courtney Bucky. I am a radiotherapy medical physicist in the radiation oncology department at the Mayo Clinic in Arizona, over by the Grand Canyon. For those of you who haven't had the chance to come out our way, it's very, very hot. But I was very fortunate to meet some of the team for the very first time at the Aortic Conference in Tunisia in the fall, and have been looking forward to this since then.
Great, welcome. Umi.
Hello, everyone. Am I unmuted? My name is Umi Musa Umar. I'm a radiotherapy and public health specialist from Nigeria. I practice at the National Hospital, the first radiotherapy center in West Africa, and I'm also the founder of Call of Cancer Initiative, an NGO dedicated to creating awareness on cancer, radiotherapy, and anything around cancer control in Nigeria and Africa at large. It's nice to be here. Thank you so much for having me.
Oh, thank you. Lareb.
Hello, everyone. This is Larib Khan from Karachi, Pakistan, and I'm a radiation oncologist. Currently, I'm working at a public cyber knife unit and belonging from an LMIC. It's a privilege to be treating patients for free, and I'm here to bridge the resource and knowledge gap within my region. So it's very good to connect with you all.
Thank you. And Suleiman, I'm not sure how to say your name as well. I hope I did okay.
Too. Hello, thank you for the invitation. I am Auf Suleiman, a radiation oncologist from Baghdad, Iraq. I completed my residency in Jordan, KCC, now running service in two centers, in Atat Center and Andalus Center. I led one of the important social media platform for radiotherapy awareness and education. Thank you.
Fantastic. Welcome. Deborah.
Good morning, everyone. I am part of Yolanda's academic team at the University of Newcastle, career radiation therapist, and looking forward to being part of all this again.
Fantastic. Etiza, I'm sorry, I don't know how to say your name.
It's fine. My name is Effie. You can call me Effie.
Oh, Effie, that's
Yeah.
easy.
Yeah, my full name is Eftichia Tataridou. I'm a resident in radiation oncology in Greece, in Thessaloniki City, and I'm very excited to collaborate with all of you.
Fantastic. And Shakaboti.
Okay, Sandra, can you hear me?
Yes, we can.
Yeah, I'm Dr. Bhaskar Chakraborty. Yeah, Dr. Bhaskar Chakraborty. I'm from Bangladesh. I'm a consultant clinical oncologist working both in public as well as corporate sectors. So I do my practice both in Chittagong as well as in Dhaka and in the heavy burden centers of Bangladesh. So I see lots of patients from different classes of the society, and I'm also very much keen and interested to work for the survivors, for the benefit of the survivors, and to focus the survivors in the society. So I'm really delighted to be a part of your society. Thank you. Thank you very much.
Fantastic. And we've seen some of the work you've already done with consumers and patients. That's brilliant. Kath. We can't hear you. I can see that you've turned mute off, but there might be something about, are you using your computer mic? If not, we can come back to you. Do you want to just put a little intro? Can't hear you, sorry. Put a little intro in the chat, and if we can sort it out, we'll come back to you. Sorry about that. Welcome anyway. Alison.
Hi everyone, my name's Alison. I'm a radiation therapist from Sydney, Australia, and I'm a keen advocate for raising awareness around radiation therapy.
Fantastic. Now I can't see everybody on my screen. Amy, I can see Amy K. Is Amy there? No, just words on a screen. And who else? Please help me, team, if you can see names that I can't see. Oh, that might be everybody for now. Is there anybody
I
else?
think that should be everyone. Amy K just wrote morning, everyone. So I believe she might have some difficulties with the mic.
Okay. Well, great. Look, it's really exciting to see the diverse group of professionals and really from pretty well all parts of the world. So that's super exciting. Please do put things in chat if you're not able to if your mic's not working, and we will ask you some questions so you can put some ideas in chat as we go along. I'm now going to hand over to Katie for a quick straw poll of hands.
Yeah, thank you, Sanjay. We just thought we'd just start with just 2 warm-up questions. So either pop your hands up physically or pop your answer in the chat. So the first question is, do you already take part in radiotherapy advocacy work in your country or region? Just have a quick. It doesn't matter if you don't. We're keen that started with RAD, if not already.
Great, I can see a lot of thumbs up, hands up.
Yeah, great. And the second question is, did you participate in RAD last year, so in RAD 2025?
Yeah, so quite a lot of people, but not everybody necessarily. So
a few people new and a few people old.
Okay, welcome. All right, now for those of you that were involved last year, you obviously saw a lot of, and we're creating a lot of what was happening and a lot of the buzz. So thank you for that. Really, this is only as successful as people's enthusiasm. For those of you that want a recap or that weren't involved last year, we thought we'd just show our highlights video just to get everybody inspired again. Here we go.
8, 7, 6, 5, 4, 3, 2, 1.
World Radiotherapy Awareness Day is a global movement dedicated to raising awareness of the essential role of radiotherapy in treating cancer, relieving symptoms, and improving quality of life for people living with cancer. RAD aims to improve awareness and access, educate patients and professionals, and celebrate the skilled workforce that makes this important, life-saving cancer treatment possible. Over half of people with cancer require radiotherapy. Radiotherapy contributes to nearly half of all cancer cures. Every year, 1 million more lives could be saved by improving access to radiotherapy. Compared to other cancer treatments, radiotherapy is undervalued, underused, and misunderstood, and too many patients miss out. The first RAD was a huge success, with support from over 75 organisations and website visits from across 109 countries. Around 50 RAD events were held across the world, with social media lighting up as the global radiotherapy community came together to celebrate. This year's RAD theme is One Voice for Radiotherapy.
One voice for radiotherapy. Together, let us raise one voice.
RAD is a truly collaborative celebration of our field and the first step in building lasting awareness of radiotherapy around the globe.
One voice for radiotherapy. One Radiotherapy Awareness Day.
World Radiotherapy Awareness Day is not just a day, it's a growing global community. Join the movement. Visit worldradiotherapy.org. Encourage your organisation to become a supporter. Follow, like, and share RAD social media. Together, with your help and the support of partners from all over the world, we can bring radiotherapy the recognition it deserves.
So I hope that gets the inspirational juices flowing. It gives me goosebumps. That video is really amazing, and there were so many other incredible activities and things. We can't showcase them all. Just a few statistics. We won't go through all the metrics, but we had thousands and thousands of interactions on our website and across social media from 109 countries. We had, by last year, we had 75 national societies that had formally partnered. with us. And since then, we've pleasingly had many more approach us, and you can see them on the website. And we had just under 50 formal registered events, but we'll come back to that later because we know that we missed a lot of activity that was happening around the world that was more spontaneous and we didn't know about. So that was really, really exciting. And we think we can do bigger and better this year. Now, in the next section, we're going to showcase just a small number of ideas that people have had already for 2026. We know many of you will be thinking about other things, or hopefully will get inspired to think about other things. So we've just invited a few people that have approached us with ideas to have a couple of minutes just to talk about those to the group, to get a sense of some things that other people are doing. Have I skipped too far ahead? Yeah, I have. Sorry. That will come in a second. But before we do that, coming back to the results of the survey that many of you, thank you very much, filled in advance. There were 42 respondents from 25 countries. And I'm actually going to throw to Lucinda to go through a few of the results so we can see where people sit at the moment. Over to you, Lou.
Thanks, Sandra. So this is just a snapshot of everybody's professions that have participated in these regional champions sessions. I think one of the great things is just how we've captured and people are interested from all the radiation oncology professions, which is a great reflection of the fact that we all work in these really highly skilled, amazing teams, and we're all needed to get to do the job that we do. It would be wonderful to have in the future, as Sandra mentioned, more consumers. Very pleased we have some physicists. It'd be great to build up some more physics participation, but the multidisciplinary representation is really exciting. And of course, the global spread, 25 countries, is just amazing.
And just to jump in, by consumers, that's the word we use in Australia. I know you don't.
For patients, that's right. Yeah.
Oh, sorry. You're waiting
No,
for
no.
me.
And so this is a selection of various reasons why people signed up to be a regional champion. Obviously, the leading one is that people just want to get more involved, which is fantastic. I love the fact that people are here to share ideas with each other because that's what we envisaged. There's more power in numbers in terms of coming up with really novel, fun, impactful ideas for World Radiotherapy Awareness Day. And also that people want to expand their networks and build a sort of coalition of the willing around the world. So it's fantastic. So people have outlined what you want the most help with. So I've got small children in the background. Sorry if there's some background noise of kids running around. I really like the fact that people are interested in creating new resources. We're very keen to get resources up and running that suit people's local environments, their cultural environments, take all the RAD messaging and provide translations in as many languages as possible. So that's a really exciting space and great to see that people are interested in that. Again, a selection of the types of resources that people are afterwards, a good array. Again, as I said, logos in new languages we're very keen to work on. Short videos about radiotherapy. I mean, we all know that video is king in the digital and social media world at the moment. So these are all things that we'd love to work with everybody to further develop. People already have pre-existing links. Some people don't, and that's great. Both work and hopefully with being involved in this regional champions group, your links with the RAD community around the world will build. So it's really exciting.
Thank you, Lucinda. And yeah, I was particularly interested in this result from you completing the survey. Don't worry, by the way, if you didn't complete the survey. We know that some people were getting it pretty last minute. This was just to give us a bit of a snapshot. So if you're here and you didn't do the survey, that's completely okay. We will be obviously reaching out to everybody again, but there were at least 25 different cancer patient organisations and groups that you already had links and contacts with. So we'll definitely be following up with those so that we can make sure that we're capturing all of those. We're going to have a spreadsheet with all the organisations that you know of, and use that to build a coalition of patients and consumers. So that's going to be really, really helpful for us. Thank you. Right, now I jumped a bit far ahead, but now I will come to our selected speakers. Thank you very much, everybody who came forward with ideas and who agreed to say a couple of words at this meeting. Starting off with Umi, please.
Thank you very much, Sandra, Kitty, and everyone here. Good evening again. My name is Umi Musa Umar. I know that we don't have time, so I'm just going to be really fast to get the message out. I believe that as a regional champion, this is a great opportunity to share a concept that has emerged from conversations with colleagues across Africa and even across the world. While radiotherapy awareness challenges vary across countries, I feel many of us face similar issues: limited public awareness, workforce visibility challenges, access gaps especially, and fragmented advocacy efforts. So my proposal is not simply a conference, as you can see from the screen. It is the creation of an Africa World Radiotherapy Awareness Day platform that can bring together professionals, patients, advocates, and institutions around the WRAD mission. And I'm proposing we start with a modest pilot summit in Nigeria this 2026, which with the small talks I've had with some organizations, we've already had a lot of momentum around. And learning from the experience, we can gradually develop a rotating Africa RAD model owned collectively by the RAD Global and the African stakeholders. Our goal is to create a sustainable mechanism for awareness, collaboration, advocacy that would strengthen the RAD mission across the continent. I look forward to working with fellow regional champions, including colleagues such as Ben. I didn't see Pokalibo. Pokalibo said he was going to be here too from Tanzania.
He was at the previous one.
This morning.
Yes.
Oh, okay. So I hope we can co-create this vision and to ensure that it reflects the diversity of the African context and the global mission to create more awareness around radiotherapy and its safety and its importance. I'm talking from a country that has over 220 million people. We are talking 250 million now, and we barely have 10 functioning linear accelerators. So I think that can show the gross inadequacy of radiotherapy services in low and middle income countries. Thank you, everyone. This is all I have to say.
Thank you. And I mean, you're incredibly active in so many areas, Umi. We really appreciate your expertise and you've got such great ideas. So really looking forward to supporting you in any way we can.
Thank you.
And sort of on that theme then, Ben, moving to your ideas.
Thank you, Sandra, once again, and thank you, Umi, for that idea. It's really brilliant, and it will be great to collaborate with you. From my end, still, I should say, when you look at centers in low middle income countries, we somehow face similar challenges: stigma, misinformation, inadequate access to radiotherapy. So it is very, very pertinent at this stage, especially with the RAD initiative, that we really take up the mantle to get the message out. We really have to get the message out. So Martin and myself, we envisioned RAD and beyond as one of the strategies to get the message out to the local communities in this case. Because to be honest, I think our target should not, whereas we really want to involve the professionals in the field, we need more of the common man, like the people down in the communities. They need this information. We need to create a space that can offer this insightful information free of charge, like no consultation fees, because these people are already stretched economically. So if we have a platform that shares this pertinent information, that advocates for them, that shares survivor stories, because it is very common to hear biased stories about radiotherapy within the communities, especially when people suffer, like have bad experience with radiotherapy. But it is hard to hear or to have exposure to survivor experiences, like to have their voices out there. So we need to capture these stories to change the narrative. So RAD and Beyond is a RAD aligned community engagement and digital advocacy platform, which is aimed to translate the RAD's objectives into the local context that people can easily understand and into actionable things that we can really progress the field and move on. So it will be very important to collaborate with the rest of you. It is starting small. We've already started with some few videos, and we hopefully intend to extend the mission to other countries in the different languages, because in Africa, most prominently, we have the Kiswahili, we have the Arabic and English and French. So if we can target stories around these languages, we can definitely have the message out there for the community. Thank you for that.
That's fantastic, Ben. Yeah, good on you and for getting started with doing something so practical. And I think, yeah, one thing that we would like to definitely, or people seem to have a need for, is some maybe some shorter, simpler, explanatory videos around what radiotherapy is, but definitely make it so it's applicable as possible to all parts of the world, and have it translated with AI translations in a number of languages. And that's where we can, I think, get help from everybody in sort of sense checking the translations, make sure that they work. Okay, fantastic. And last but not least, I've actually asked Lucinda to present an idea from our part of the world, something maybe not quite so grand, that's come from another radiation therapist. Lou, I'll flick to you. Thank you.
So again, this is, as Sandra said, an idea from our radiation therapists at Westmead Hospital in Sydney. But this initiative is aimed at getting high school students and university students into our radiation oncology department for a careers education evening. And I guess the idea came from the fact that so many people in the community around the world know very little about radiation oncology. Everybody knows what a doctor and a nurse is, but often nobody knows what a radiation therapist is, or a physicist, or a radiation oncologist. I'm sure you've all experienced that in your social life when you have to explain to people what it is that you do. So what we're doing is opening the doors to the department to older high school students, year 10, 11 and 12, and university students, and bringing them in to give them a behind the scenes look at what it's like in a radiation oncology department. So they'll go through a series of hands-on stations. They'll see the planning room, they'll see the linacs and the setup in those areas, and they'll learn about how the team work together from the team, so from the physicists, radiation therapists and radiation oncologists and nurses, and then learn about the training pathways for the various professions. And so for us, it's more about just more than just raising awareness of radiotherapy as a treatment. It's also inspiring that next generation of our workforce. We all know that globally the workforce has a real sustainability problem looking into the future. So this is aimed at inspiring that next generation of young people to come into radiation oncology and work in our wonderful field. Thank you, Sandra.
Thanks, Lucinda. Katie, I might just throw to you to start talking about next steps.
Great, thank you. And thank you to all our speakers for all those sort of wonderful ideas, both very large and visionary and sort of small and impactful. And I think, it's important that, the advocacy ideas can be big and expansive and build towards bringing in patient advocacy groups and policymakers. But it's also just as important to run those small events. So we need all of the activity, both big and small. Some more perhaps contained ideas might be perhaps to hold a coffee morning or a cake event in your department, to decorate your department, to develop some social media pictures, stories, and videos. One of the medical physicists in my department last year did some short video clips around the day in the life of a medical physicist in London, which was very sort of impactful and perhaps led into a similar idea to the one that Lucinda's talking about, that bringing in that sort of new generation to want to actually come into the radiotherapy profession. Another idea might be to talk to other departments within your hospital or other individuals within your cancer multidisciplinary team. In my centre, we brought the surgeons down to the Linacs and gave a short talk and demonstration about radiotherapy, really to try and improve their knowledge and communication about radiotherapy, and really aid patient decisions who are trying to choose between surgery and radiotherapy as an option, and how important it is that surgeons are also advocating for radiotherapy as a safe, effective cancer treatment. Please also look at our website. We have our resource toolkit that is full of posters and logos and banners that you can use to decorate your department and can also be used as social media posts. And please do also look at the news stories and events on our website to give you some ideas. We had some great highlights from last year. We had a radiotherapy walk in Namibia as one particular example that I remember, but there's many other ideas sort of embedded in those news stories. So great, I'll just hand back to Sandra just to talk further about next steps.
Thanks, Katie. And just at the bottom of that slide there, you can see that we're going to set up a WhatsApp group for the regional champions. Many of you in the survey, well, pretty well everybody said they would like to be linked to the group. But if there are people here that didn't get to do the survey, or there are other people that you know of in your departments or networks that realise that they missed out, we're very keen to be inclusive, and just let us know. We'll give you some email contacts so you can let us know what your mobile number is and we can link you up. And we've already, from our previous meeting, have people saying that they might have some sort of sub regional champion groups where they get together with other people in their region to progress ideas. And that's exactly what we'd like to see happening. So we really encourage you to do that. Not everything, we can't possibly oversee everything. We don't want to, and you don't need us to. So we're here to help, but please go for it. If you want advice or think about resources and other things, please just let us know what we can do to help you. We're going really well in terms of time. So I'm very aware that there are many people here that are doing great stuff and did fantastic things for last year. I just wondered if there's anybody that would like to just say a couple of words for the next few minutes. We could fill 5 minutes with other people with a couple of other ideas they've got leading towards 2026. I don't know if anybody's brave enough to speak spontaneously. I probably can't see everybody's hands, so please, committee, if you see anybody stick their hand up or want to
See
give an
Yolanda
idea.
looking on Zoom. But they did some fantastic stuff at the university as an organisation. But
Yeah, Yolanda, we'll put you
Yolanda, I
on the
won't.
spot. Any thoughts about 2026 that you'd like to share?
I do. So I was thinking we have an army of advocates in our students, and we send them out all over Australia and New Zealand and sometimes beyond. So I think.
Oh, Yolanda, your audio, is anyone, are you hearing her audio properly?
You're
Oh,
very
there we go.
quiet.
Much
You got
better.
me now?
Yeah, got you.
Okay, sorry. Oh, good. I got to practice that. I can say it again. What I was thinking is that we have an army of advocates really in our students, and we send our students out all over Australia, New Zealand, and sometimes beyond that. And they're willing advocates too. So I think if we can find ways to use them in the nicest way to promote what we're doing, they're super keen, and you can see by those videos they loved being involved in anything once we explained to them that it was all about their profession and the benefits of. So if anybody can think of ways that we can use this army beyond us, I think that would be a really good way to do it.
Love it. Love an army.
Thank you.
That's
I think
great.
there might have been a couple of other people in chat. Did I see?
Umi and Larab both have their hands up.
Well, maybe Larab first then. Lovely to hear from you.
So I have a quick question, also a comment. The question is about, are we going to have any other meeting before 7th of September to further discuss the activities, RAD activities? Or my comment is, as I have discussed already during the extra as well with Professor Sandra, that we have this national initiative, which is Radiation Oncology Interest Group, which is led by resident trainees and medical students. So this is another thing which we can work on to educate the medical students in the private and both public centers there, so they can act like patient advocates and spread the word. So yes, we'll be collaborating with this also.
Definitely. Yeah, that's great. And we do a bit of a similar thing, Larab, in our centre, that
Yes.
we bring medical students in and look, if it's helpful we have a framework for a little outline that covers in a couple of our interactive workshop and stations that people rotate around. That could be something, that model that we could share. But definitely, yeah, it'd be lovely to talk more about that. I was just before we get Umi again, I noticed that Sandra Lemos joined the group. And I wondered, Sandra, sorry to put you on the spot, but would everybody else beforehand just introduced who they were and where they're from? Are you able to do that? Maybe pop your video on? Or maybe not? No, that's okay. That's okay. If Sandra's maybe not there anymore. Umi, what did you want to say?
Also, I just want to put this out there about an idea of encouraging the younger ones to join the radiotherapy workshop. I think personally, I have a very interesting story of how I went into radiotherapy without wanting to be there, pushing not to be there, but then I was like literally forced. And it's now something that encourages the younger ones. I think everyone says for the first time in Nigeria, radiographers in the diagnostic, radiology, show interest. Interns want to come to radiotherapy. This is the first time in national hospitals over 50 years that interns from the radiology, radiography interns are sent to us. This is the first year we've ever had interns because they see me on social media. My name on Instagram is Radiotherapist. And because of the activities I do and the kind of engagement I get, they think it's cool now. So I think it's how we present the message to them and how we project our work. We know the Gen Z like cool stuff. And I think radiotherapy is really cool. We don't even have to pretend it is, with our big
Yeah,
toys
we
and
are
all.
cool.
So I think that is something that we could leverage, tell our stories out there, how we got into radiotherapy ourselves.
Yeah, definitely. That's a really great idea, and it's really the enthusiasm's infectious, isn't it? And again, we get a lot of people coming through on the medical side who have done the workshop, didn't know about radiotherapy as medical students. So yes, excellent ideas, and anything like that. I was going to say, it doesn't have to be around September the 7th. If something happens or there's an event, an activity in your department that you can sort of brand as RAD by having some posters and things. We want to hear about all those things. So yes, there'll be a big build up towards September the 7th. But anything that happens if you talk at a meeting or, have photos or events that through the year, please do let us know about those because that all builds the momentum and the excitement. To answer Larry's question about are we going to have another meeting, that was actually something that I was going to ask all of you, maybe with a show of hands or a comment in the chat. Do you think it would be helpful to say in a month's time, come together again just to talk a bit more loosely? We wouldn't have such a structured meeting, but just to have a forum where people can chat about ideas and their ideas, get ideas from others. Just if you can let us know now whether that would be something you'd be interested in, that would be helpful.
And Sandra Baskar's got his hand up as well from
Oh,
before.
fantastic. Okay, great. That looks like it's quite a popular idea. Pascal. Oh, sorry, who was it? Oh, Pascal. Yeah, sorry. Go for it.
Yeah. So am I audible to you? Yeah.
Yes, you are.
So, ma'am, I have one question to all of you. That in our country, like Bangladesh, so I basically, being a clinical oncologist, I basically struggle in different sectors, starting from the general public to, in fact, some senior colleagues as well, because each and everyone has different thoughts about radiation therapy, and right now no one is agreed right now in that position to think that radiotherapy is a very powerful weapon. So that's why I try my level best to create awareness in each and every sector of our country. So I've sent you one journal, one paper I've sent you, that I basically arranges different programs to create awareness in each and every sector of our country, including the general public to consultants. So recently I basically arranged one mela or fair. So there, the survivors basically arranged the programs. They were the entrepreneurs of the programs, and they did everything. So that's why the media coverage was there. I invited all of the consultants of each and every sectors. The renowned populations of each of the sector, and they basically came to the program, and there I highlighted what about the effect of radiation therapy, what about the benefits of radiation therapy. There I focused the survivors, how a magic can happen with radiation therapy. So I do practice this one, and I will be very happy if you from the word community also join in our meetings and our programs to highlight that radiation is such a effective one. So that's the issue.
That's great. Thank you. And look, if you are doing any programs like that or activities, let us know. If you're putting things out on media, please mention World Radiotherapy Awareness Day and the website address. And then that is another really great way to sort of build our movement. So thank you for that. It's really important when you do have ideas. I call them events, but they could just be activities or an idea, something big or small. Please make sure we know about them. And the best way to do that is to there's an events tab on the website. We're actually doing some work on the website to make the resources a bit easier to find and search. Many of you probably that use them would have gone through many different tabs to try and find what suited you, a post or a social media post or whatever. So we're going to try and make that a bit easier for you. So that's one thing. But on the website, go to the events and you'll see there's a button there at the top saying send your event. So either press on that, or if you scroll down to the bottom of the events page, you'll see this event submission form. And that's how we will know who you are, where the event's happening and what it is. And then when the event has happened, we will reach out to you, or please be in contact with us with photos or a bit more about the event or the success of the event. And then what we'd really like to do is feature many of those on our website, on social media, from our RAD channels directly. We'll obviously be looking out for what you're doing on social media, but it is really nice to know what events are coming up. And also for our sponsors, it's really important to be able to collect the statistics around the number of events that are attached to RAD. The other way is you can email us, and we'll give you some contacts later on. So there are plenty of ways of getting in touch with us, but I really encourage you to use the submission form, please. Even if you don't have all the details, that's fine. We just need to know the concept. So thank you for that. One thing at the moment we can't do to support you is provide funding. That might be something that happens in the future, but we can probably give you some ideas about who you might be able to reach out to, or there'll be other regional champions in your area that can advise you where they've got some money to run an event, or perhaps something bigger if you've got some grander ideas. We certainly can help find links in your region to industry that might be able to offer a small grant. So we don't have money directly to support you, but we can help you contact people that might. Similarly, if there's anything else that you think of that is not you didn't put in the survey that we might be able to do to support you, we really want to hear from you. One smaller thing you can do is please, on the channels that you support, follow us on those social media channels, and please circulate those to everybody you know. Luckily, in this younger age, where lots of people are using socials, this is becoming a more and more powerful way to reach people, both the professionals and our patients and community. So please share those and get as many people as you can to follow us. And as many of you would already know, those are the hashtags on the bottom. I should also say that Karen Carr, who isn't on this meeting but was on the previous one, has come on as a social media comms consultant. And she will be reaching out to many of you in this meeting, or people that register their ideas, to ask if you would do a mini interview or a post, a blog, or something that we can use to promote your ideas and activities. And we would love to put them on our website, put them in our news channel. So if Karen reaches out to you from RAD, you'll know who she is. No obligation at all, but just if you would like to use our channels to amplify your efforts, that would be fantastic. Okay, so we should think about closing up now. Back to you, Katie, for our final goodbyes.